It's essential that all practical measures are taken before the start of every shift to ensure the highest standard of infection prevention and control and safeguard the well-being of patients, carers, healthcare professionals and other staff. At the beginning of your shift, you must confirm that all 7 post-shift tasks have been completed. These checks are crucial to ensure your ambulance is clean, safe and ready for operational use. If any of these tasks have not been carried out, you must complete the cleaning schedule and preparation before the vehicle can be deployed. This is not just about compliance, it's about patient safety and professional accountability. The Vehicle Daily Inspection, or VDI, must formally record all actions. This includes ticking the appropriate boxes and providing your signature to confirm that the required tasks have been completed to standard. These checks are a key part of the NHS infection control procedures and ensure that all staff and patient are protected from avoidable risk. Always refer to your Trust local IPC policy and escalation pathway if in doubt.